the SUBITO trial was designed to substantially improve the outcome of a rare group of patients. And this considers stage 3 HER2 negative breast cancer with traits of homologous recombination deficiency. And this tumor occurs mainly in very young patients, around 40 years of age, who have just started a family and start building their career. Now, we know that this group of patients has a 5-year survival of around 65% based on the CLGB 40603 study. And this was a study where all patients received third-generation chemotherapy, and half of these patients also received carboplatin. Now, the SUBITO study was conceived much earlier in 2013, and it was based on a post-hoc analysis of a large randomized clinical trial where intensified alkylating chemotherapy was compared to standard chemotherapy, 5 times FAC. Because of the drugs used in the intensified alkylating regimen, we hypothesized that in fact patients who have a tumor with traits of homologous recombination deficiency would really derive benefit from that treatment. Now, homologous recombination deficiency causes sensitivity to drugs that induce DNA double-strand breaks, such as alkylating agents, carboplatin, and PARP inhibitors. So the intensified regimen consisted of these types of drugs. And what we found in the post-hoc analysis was that indeed the 4-year overall survival of patients with HRD tumors was quite favorable, almost 80%, while it was only 35% with standard FAC. That was the standard treatment at the time. So, well, these were quite promising results, but of course required prospective confirmation. And also, now we are in a different era. So we also asked ourselves whether we could obtain similar survival results with a third-generation carboplatin-containing chemotherapy, followed by 1 year of adjuvant Olaparib. So that was the basis for the study. Well, we enrolled 174 patients in this study, and of the patients we selected, 70% had an HRD tumor. The study population was representative of indeed young patients, mainly with stage 3 triple-negative breast cancer. And of note, around 50% had really high-risk disease, stage 3C disease, which is known to confer a really poor prognosis and is often excluded from registration trials, such as Keynote 522. 90% of patients had triple-negative disease, and 27% had a germline BRCA mutation. Well, the 4-year survival rate was 77% in patients who had received the intensified alkylating chemotherapy. And in fact, that confirmed our earlier results. But most striking, I think, was the 4-year survival of the optimized conventional arm, which was virtually identical, and in fact, for the first time, demonstrated that a third-generation carboplatin-containing chemotherapy followed by 1 year of Olaparib, so really targeting HRD, can yield similar results. So I think that is really the main message of this study, that if you select the right population, so patients with HRD tumors, and then you administer a regimen that targets HRD, then you can obtain quite favorable outcomes in this group of patients with really high-risk disease.